Before today's appointment, I felt quite in the dark about my own health. I didn't feel like anybody really knew, and therefore it was kind of like a shrug their shoulders. We don't know, mystery.
I didn't know what was happening. I wasn't remembering anything, and going through the changes in my body, I felt that there was no one to actually talk to.
Before I started talking about this, I was really shy because I wasn't really used to talking about these things.
Today we are talking with the community. We are bringing the clinic to the community and using this opportunity to do an outreach and normalize conversations about family planning.
The Women and Girls Health Hub isn't just a place, it's coordinated activity by different health teams all working together to help increase access to women's health in Lambeth. It is a clinic that women can be referred in to go and see a team, but it's also events like today where we've got community education sessions happening. It's also our health champions that are going out across the borough into communities to reach people and have conversations with women and girls about their health.
We are focusing on coming out from hospital to community, and we're also focusing on preventative medicine. This means that we are close to where women live and we can see them in a community clinic, but it also means that because we're seeing them earlier on, we can hopefully prevent a condition from becoming chronic, but also progressing.
I went to one GP who didn't know. She said, I don't know, but I could direct you to someone who might.
The main benefits are that women get their problems dealt with much quicker by someone with the right expertise to be able to manage their problems without them having to travel long distances or sit on long waiting lists. What we have in this clinic is we have more specialist knowledge and a bit more time to be able to come up with a few extra tricks up our sleeve, which is what I did today.
We ran Menopause for Carers specifically because of the challenges that carers face, because often they're quite stressed, they're feeling burnt out, and they're unable to distinguish between menopause symptoms and caregiving and the stress that causes.
I was trying to juggle quite a few things, being a full-time carer for 2 parents now.
At least 3 of the women that came to the programme had really high blood pressure, and we had to send them to their doctors immediately. And in fact, one of them had to go to A&E that same day.
I got out coming to these sessions and I was smiling that there were other women who, like myself, are going through the same thing. Listening to other people's experiences, I realised now that it was all related to the menopause.
The Girls United Menstrual Health Women and Girls project was around how we can make sure that people feel more confident when on their cycle in different phases to still be active and play football. They are at a younger age, but also just ready to have those conversations, I think is great.
Before, when I had the talk with the coaches, I felt a little bit shy, but now I feel more confident. Having my period, which it hasn't even come on yet, but if I did, I'd know to tell them and I wouldn't be afraid about it.
The attendees were a little bit shy maybe, but I have some prompt questions that are making the conversation more normal. So I can see that they are interacting between each other and they are asking questions more relaxed as well. Actually, listening to other people, they realize that they are not alone and many people are experiencing the same.
Este evento me pareció muy informativo y muy provechoso para toda la comunidad latina, ya que fue dado en español.
Through this work, we're addressing health inequalities because for some women and girls, there are higher barriers for them accessing good health provision. They might be cultural reasons or language barriers, it might be stigma, or it might be that they're on low incomes.
Women's health especially can be something quite private and it can be something quite difficult to talk about. I think having a community-based centre can make a big difference.
Doing this project myself and being part of it made me more aware of what I had maybe been through as an individual and stuff that I hadn't learned when I was a young player playing, and what maybe could have helped me stay in football and feel more confident. Being able to take that and like introduce it to the next generation means that more barriers will be broken in the future, hopefully. 2, 3, yeah!
Before I came across Carers for Carers, I'd forgotten about myself because I am a full-time carer for my parents. I then came here, met other women who were in the same position as myself, and I learned so much, and I now feel like I've got a voice.
If you have the Women's Health Hub as a unique centre that can provide different services to only one population, can be very helpful in many senses, because you have everything in one place.
It's good for society if women are supported, but also on an individual level, we want women to be able to show up in their lives and not be inhibited by having conditions that could otherwise be treated.
Women and girls' health done well means life-changing opportunities for both women and girls, but also a positive ripple effect through communities.